to the body's innate ability to heal itself. Like something's gone too far.
Right.
Right. I experienced this personally. I trained as a naturopathic physician, and this was a very difficult decision for me to make. But at the very top of that pyramid is things like pharmaceuticals and surgery, right? And integrative medicine is saying these things are important and we have to bring them in, but then how do we help someone through that? Mm-hmm. So can I share with you a little bit of my journey?
Oh yeah.
Because this was really hard, and I think other people are in this boat. Mm-hmm. And I can kind of say how I was able to bring it all back in, but I have for a long time, I have had an underlying condition where the root cause was never actually determined. I think the loneliness epidemic is a big part of this, honestly. I think, and it's something at some point I definitely want to talk about, because it is a huge predicator for chronic disease mortality. You wouldn't believe what I tell you. I will go back to it. How social stress, how much of a predictor of chronic disease mortality it is. Mm-hmm. But at any rate, in my individual health, I could not lose weight. I was way overweight, obese. And I was having a lot of trouble. One of my main things, certainly arthritis, pain, all the itises. The most important one was esophagitis. So in my throat, my voice was hoarse, and I started having difficulty swallowing as far back as 2012, 2013. I noticed food would get stuck. Yeah. And so I tried to address this naturopathically. I tried to reduce but I wasn't reducing inflammation holistically, mm-hmm. necessarily. And I didn't have a coach back then. And I was kind of winging it. And I had a lot of root cause issues happening, and I couldn't do it that way. And I had a very difficult time losing weight on my own, like so many of us do. I tried everything. And then, and I didn't understand how change in us works. So at any rate, I finally had to get the endoscopies done, to take a look, and they had to, put the balloon in there and expand my esophagus so I could swallow. The doctors that do those things want you on medicine if they're going to continue to do them. Yep. So, I went on a Prilosec type thing, because they felt that it was all related to reflux, even though I didn't test that I had reflux. But I probably did it. I'm sure I did, through my lifestyle of craziness. Before I discovered any of this medicine, and after, there was still, I was still having issues. And at any rate, they put me, I started taking Prilosec, which caused all these other problems. Here we go. Where were we?
And we're back. This is, thank goodness for modern technology, and Florida and our power surges is what happened. So we were in your story. You were sharing about where you were with being overweight and trying different things to try and lose weight, and then going at it from different angles, and then finally deciding that you needed
surgery. Yes. Was needed. Yeah, so to do the surgery, for insurance purposes at least, they recommend 6 months of nutritional counseling, and you see a psychiatrist who determines that you are. At any rate, for the first 4 months of that 6 months of nutritional consulting, I was trying to see, if I could lose weight some other way. It had to come off drastically and quickly, but at any rate, by the time I determined that I needed to do this, I needed to do it this way. It was about, my surgery was in July, or potentially in July, and by about May, I connected with a health coach. In March, I had decided I wanted to be one, and that this would be a really interesting program. And I thought, this is an amazing thing, because, with my education, I have all this information, right? I know what to do. but I couldn't get to the end result. And when I read about what functional medicine coaches can do, and they can bridge that gap, they can form that road, help you get on that path, I was very intrigued. So the health coach really helped me prepare and to get in the right frame of mind a little bit, because I was so torn. My nutritionist was very good too. And she said that she'd support me no matter what I decided. I didn't have to go through the surgery. I never felt like I had to.
I have two questions for you before you
Sure.
go any further.
Sure.
So you were going in for bariatric surgery, is that correct?
That is correct.
Okay.
Yes, and the reason for that, not just for the weight loss, which should have actually ended up helping with a lot of other things like sleep apnea, and certainly the swallowing should get better, and energy and all those things. I'm still working on a lot of those factors. Surgery did not correct that. I did lose a lot of weight, no doubt about it. Wrinkles now I didn't used to have, but my neck was like out of here, so it's no wonder, right? And all that pressure could not have helped. So that part was beneficial. What was the other part of the question? Wait, I forget what you were asking.
I just first asked if that was bariatric surgery that you were going.
Oh yeah. So the reason was because they still were saying that it's reflux, which I'm still not convinced necessarily of that. But the surgery that I had reroutes everything. So now I have to focus very much on getting nutrients in, because I was getting from the medication, I feel like I was getting reflux of bile from my liver and gallbladder in all the way into my small intestine, into my stomach. Like significant amounts. My family history predisposes me to duodenal, which is a small intestine, and stomach cancer. My grandfather died of that. So I didn't want that sitting around in there. So what we've done is prevented the bile from ever coming into my stomach. That's not going to happen. That's disconnected. But that area of the small intestine is also really important for nutrient absorption. So I work with coaches and other functional medicine practitioners now in really getting as much nutrient density in foods and even protein shakes and so forth as I can, like maximizing that.
So with the nutritionist that you were working with prior to your surgery, was that nutritionist a traditional, like a traditionally trained nutritionist, or was that person a functional medicine nutritionist?
She was very much a traditionally trained nutritionist.
Okay.
So she is a wonderful person. She's actually shouldn't have even been doing the nutrition stuff because she's done it for 30 years. She's now the dietary manager, like in charge of the entire hospital's dietetics.
Yep.
And then doing this too. I mean, she was always running around, and she had the skirt, the suit and heels, and you're running around trying to meet with me. She's a wonderful person, very holistically supportive. But I had to come up with my own way of getting nutrient density and that sort of thing.
The reason why I asked was because, I know that anyone who's a functional medicine certified practitioner of nutrition or dietitian, they have to be originally traditionally medically trained, and then expand outward, into, going to the root cause instead of just, here's the Band-Aid. I was just curious if, when you were comparing what her health or nutritional advice was versus some of the nutritionists in functional medicine that we were trained by, what was the difference between the two, did you hear?
So, at least for bariatric surgery, they are very focused on protein, and more protein. So they want you to, they didn't focus on once I was out of surgery, how I was going to get nutrients in. They wanted to make sure that I drank a lot of water, very important, and got protein in first. And I understand that. And recovering from surgery, that's important too. But all white. I mean,
white
chicken, cottage cheese. You get everything pureed. But that was the big part of that's all they wanted you to eat in the beginning after you were off the protein drinks, which Mine had a whole multivitamin in it in all the most bioavailable forms of all the nutrients, at least. But most people don't get that. So I do want to work with people, even if they do have, go to this. There was no, I'm like, where do I get my vegetables? Where do I get the colors?
Where's the rainbow? Where's the rainbow?
Where's the rainbow? I can't eat like this. I mean, how am I gonna like get up off my chair when I don't have any nutrients in me and do the rest of this? And frankly, our mental health is intricately linked with our gut, right?
Mm-hmm.
And so, how people get through this, I don't know, without nutrients most of the time. But it was very, it was a book that was probably put out in the 70s. I don't know how much they've updated, like the workbook you get.
Mm-hmm.
But I would do juices, green juices.
Oh, good.
That I made. I with like one apple in the whole thing and a ton of cucumbers and a ton of kale and spinach and lime and, the mean green juice, basically, with like an apple to sweeten it, but I still think it's good. Ginger, and that's what I still do that to get those greens in.
It's something that's the reason why I asked you about your experience, with that particular nutritionist versus the ones that we were trained with in functional medicine was, so my husband and I both have been very much involved in Ayurveda. And we had an Ayurvedic physician who was also an MD. So he's more like an integrative physician because he uses Ayurveda and traditional medicine together, plus yoga. So all that kind of fits under one umbrella. So we had learned a tremendous amount of, how to eat, time of day to eat, whatnot. And all of this very immersed in this culture. So my husband was selling a brand of cooking pans called Kitchen Craft. And they're made, I think, in Wisconsin, and 100% made in America, and they are stainless steel pans. And he had an opportunity to go to a hospital to go and do a cooking demonstration for the bariatric patients who they had come out of the surgery, and they were now learning how to maintain their lifestyle with their surgery. So we show up together. Now, both of us are like complete foodies, both, very food aware since we were children, and, all excited about sharing this knowledge that we had about food and nutrition and, the nutrients you get and how important it is, and not just what you cook, but what you cook it in, because
sure,
that can affect the nutrition as well. And so we show up, and the nutritionists are giving a lecture, and then they're going to introduce us and segue into the demonstration. And all they really were focused on, and I apologize to anyone who out here is listening to this, but they were focused on reading the labels on the cans to check for the calorie content, the fat content, and the sodium content. That didn't talk about, nothing was to be raw or fresh. It was all prepackaged, frozen, right, or canned. And the two of us had to work very hard to not go, oh, all right, how are we going to recover from this? You people don't need our hands.
You need some dang nutrients. You need a garden is what you need.
Oh my gosh, it was so funny. And it
was a real learning experience.
Yeah, I'm sure.
And it was tough because my whole background, and before naturopathic medicine even, was let's do this naturally. Mm-hmm. To have that intervention was tough, but it's where you can start to integrate, though. Mm-hmm. I feel like it could be an opportunity.
Yep. Oh, absolutely. And the one thing that you said, I think, was a really key, was that you had the knowledge, but you just couldn't do it. You couldn't do what you knew.
I didn't know how.
Didn't know how.
And I had failed so many times. And before I took our functional medicine health coaching course, and before listening to Dr. Sandra Scheinbaum, who founded the FMCA, talk about failure and how that is an opportunity, I didn't think of failure that way. And I still actually have issues, imposter syndrome and doubts and, all that kind of stuff. But then I had failed so many times on my own. Mm-hmm. I just didn't know what to do anymore.
Yeah, because you're not the only one. It's so common. And when someone says, well, I know what to do, I don't need a coach. But, as you saw, and yours is a not, I wouldn't say it's not extreme. I don't want to take away from what you experience, but at the same time, I mean, whether it's something that, a small goal versus a major one like you had to, it still is having the value of someone who's there to cheer you on and kind of like put the guideposts on so that you stay in your lane and you accomplish. I mean, when we know what to do, but there's just something that lies within that is that hook that keeps us from doing it. Because sometimes I think our minds don't want us to be healthy, that they want us to, be free, or there's just so much self-induced pressure that keeps us held hostage,
And do we really think, I mean, in my case, I finally had the surgery because it came down to the fact that my why was I would really like to not embarrass myself every time I'm around good friends and we have dinner together and I have to separate myself and whatever. It was gross, but right, trying to get this food up. But so it became my why, I guess, for having the surgery, for losing the weight. Was really that, but it's so much more than that. Mm-hmm. What this means to me, and what having to go back down to the bottom of the pyramid now, because I was up there, I had the surgery, but that I can't stay up there. I can't keep taking pharmaceuticals and having surgeries. I've got to come back down and get healthy holistically. So I spend that time, at the bottom of the pyramid, or the big base of the pyramid, the 5 pillars. But at the same time, I can't do that myself either.
What's that?
I can't do that myself either, though. I still need that. Mm-hmm. I still need a coach in my life. Multiple, for different things to help me bridge and determine what my why is, and help me bridge from in here, and all the books like behind me that say all the stuff to do. And getting to that intrinsic motivation, that stuff in here, the reason why.
Yep.